Hello everyone. Today I'll be discussing on the topic Guillain-Barré syndrome. So this Guillain-Barré syndrome, also called GBS, it is a disorder of nervous system. So coming to the definition, it is an acute, rapidly progressing and potentially fatal form of polyneuritis. So what do you mean by polyneuritis? Polyneuritis, it means when many peripheral nerves involved at the same time. It is an autoimmune disorder. It affects the peripheral nervous system and results in loss of myelin. So it is an autoimmune disorder. So we know autoimmune disorders in which the body's immune system attacks its own nervous system, which cause inflammation and damages of the myelin sheath of the nerve. The syndrome was named after the French physician Guillain-Barré and Stoll, who were the first to describe it in the year of 1916. So let's see about the neuron. So you can just see this is a myelin sheath. So this myelin sheath, it is a insulating layer which covers the axon and the nerve fibers. This myelin sheath allows electrical impulses to transmit quickly along with the nerve cells and protecting the nerves from other electrical impulses. So let's see what happened in the GBS. So this is, you can see, normal nerve and this is a exposed fiber. So like because of this damaged myelin, this fiber has been exposed, axon is exposed. So because of what happened, the conduction is completely blocked, and because of conduction block, the nerves will not be able to give or send the messages to the brain, and because of that what happened, the patient will not be able to get the muscles will not be able to do the proper contraction and the relaxation, and which leads to paralysis or the loss of sensation. Next, incidence and prognosis, it can be rapid. It's a rare syndrome that can affect 1 in 1 lakh population, more common in males than females and typically seen in adults. Coming to the etiology, causes of this disorder is unknown. Some of the causes like viral infection, trauma, surgery, viral immunization or HIV may be the causes of GBS. Campylobacter jejuni is the most recognized organism associated with Guillain-Barré syndrome. Why this Campylobacter jejuni is the most affected causative factor for this GBS? Because this Campylobacter jejuni is found in the uncooked food. When we are having food without proper cooking, for example poultry, so because of that what happened, those person may have these organisms and later they may affected with the GBS. Coming to the pathophysiology, as we have already discussed about causative factors, so because of these causative factors, immune response to an foreign antigens such as infectious agent, and these infectious agents migrated to the nerve tissues and formation of the fatty layer in the nerve, which results in nerve conduction block as T cells activated and antibodies attack the myelin sheath and autoimmune attack on the peripheral nerve. So what will happen when there is a infectious agent will be migrated to the cells? So our conduction will be, nerve conduction will be blocked, and because of that our T cells will be activated and our own antibodies will attack the myelin sheath, and antibodies will think that this myelin sheath is a threat or enemy for us. Then it will lead to muscle paralysis that may be accompanied by sensory or autonomic disturbances. Coming to the signs and symptoms, there will be weakness in lower extremities progresses over hours to weeks and peaks in 14 days. Muscles of the distal extremities are severely affected. Paresthesia and paralysis follows in the extremities. So what do you mean by paresthesia? Paresthesia, it means when there is a numbness or tingling sensation, okay, in the extremities. Then other symptoms, hypotonia and areflexia. Hypotonia means when there is a decreased muscle tone, and areflexia means when there is a decrease or the reduced reflexes. Then some of the autonomic disturbances include orthostatic hypotension, hypertension, abnormal vagal response, for example bradycardia may be there, heart block and asystole. Then bowel and bladder dysfunction will be there, facial flushings and diaphoresis, which means excessive sweating. Then some other symptoms, if the disease progresses to the lower brainstem, the following cranial nerves may be affected: cranial nerve 3, 5, 6, 7, 10 and 12. So just let's review the cranial nerve. So cranial nerve third is the oculomotor, fifth one is trigeminal, sixth one is abducent, then 7 is facial, 10 is vagus and 12 is hypoglossal. So because of this affected cranial nerve, so some of the many symptoms we can see like facial weakness, difficulty with extraocular movement, dysphagia and facial paresthesia. And also there will be muscle pain and cramps, and pain appears to be worse at night. Now coming to the diagnostic findings, it based on patient history and clinical manifestation. Then lumbar puncture, CSF is normal or has low protein, but after 7 to 10 days, protein is high to 700 mg per dl. In electromyogram, shows that nerve conduction is slower, and electrocardiogram test shows heart irregularities. The nerve biopsy can be done examining the damaged nerve for action. So coming to the treatments, this treatment is the most important thing in the GBS. Like first the aim is supportive care and particularly ventilatory support. We need to give the supportive care to the patient, and we have to be ready with the ventilation because we don't know anytime patient may have respiratory or the cardiac arrest. And next one is the plasma pheresis. This, what do you mean by plasma pheresis? This plasma pheresis also we can say it is a plasma exchange. It is a procedure which involves the removal, treatment and return of blood to the body to remove the antibodies. As we know, our own antibodies attacking our own cells. So because of that, our damaged antibody have to be removed and we have to exchange this plasma. Then it will be used in the first 2 weeks of the syndrome. A dose of 40 to 50 ml per kg plasma exchange can be administered 4 times over a week, which contains healthy antibodies from blood donors. High doses of immunoglobulin can block the damaging antibodies. High dose of IV immunoglobulin at 400 mg per kg body weight for 5 days can be continued. Some other medication we have to continue with the patients with to reduce the symptoms. First, analgesic to reduce pain. We have to go for the muscle relaxation, antidepressant, anti-anxiety, stool softeners, anticonvulsant, anti-dysrhythmia and eye ointment or artificial tears. Because this medication we have to continue with the patient because of the disease condition, because of the physical immobility. Patient may go to the depression, patient may have anxiety. So for reducing this, we have to continue with this medication like antidepressant and anti-anxiety drugs. The next go to the most important thing is the nursing interventions. So monitor airway, respiratory function and arterial blood gas analysis. Monitor for cardiac dysarrhythmias and blood pressure. Assess gag reflex, corneal and swallow reflex. As we have already seen in the symptoms, there may be areflexia. So because of that, we have to assess the reflexes. Then elevate head of the bed at least 30 degree. Intermittent catheter or Foley's catheter can be applied, and we have to go for the bowel care. Then maintain adequate nutrition and hydration, assessment of pain, eye care, physical therapy like range of motion exercise to prevent contractions and foot drop. So these are the nursing intervention we have to continue with the patient with GBS. So now I have come to the end of the topic. So some homework for you, for everyone. Like first one is the what are the health education you will provide to the patient and family member. So you have to write or you have to plan a health education like where it can include like total complete definition or the symptoms, everything about the disease process. Then you can include about the dietary habits, you can include about the exercises, about the medication, you can include it the health education. And next one, write nursing care plan for patients with GBS. I have given some of the intervention for the GBS, but you have to plan a nursing care plan, like you have to formulate nursing diagnosis, then according to the nursing diagnosis you have to prepare a nursing intervention. Thank you everyone.